sonographically. All right. So, breast tissue is easily seen with ultrasound, but they can have a varied appearance depending on the amount of fat, the glandular area, and the connective tissue. You know, and also, you know, the age and puberty, part of puberty, and can change how the breasts appear on ultrasound. Okay, but breast ultrasound allows visualization in slices of the body. Of course, that's how we know we take our images, right? We take our images in slices, not necessarily like mammography, where you can see just a full breast, right? Okay, because all those are X-ray images, so all the anatomy is going to be superimposed on a mammography image. Okay. Miss Cecile, is she okay?
She's sick.
You see? Best thing about breast ultrasound, it has the ability to differentiate between all the breast zones. You can actually see all the different layers of the tissue from the skin line all the way to the chest wall. Okay? So that's the advantage of doing breast ultrasound. Breast ultrasound techs, they also make a lot of money, ladies. And a lot of the students, they love doing breasts when they're in there. All right? So let's talk about the skin layers. Go from outer to inner. Heck no. Let's go from outer to inner. With the skin layer, guys, the skin layer consists of two thin reflective bands encasing in a band of medium to level echoes. Okay, so the skin layer, the outside layer, is going to be the epidermis. That's going to be a really echogenic band within, and then there's going to be another echogenic band behind that. But within those two echogenic bands, you're going to see a medium gray layer of tissue. Okay? It's, again, the skin layer is really thin, and you can see the layers of the skin that way. Okay, so two echogenic bands. We'll show them in the image coming up. Okay, representing the dermis. If you use a standout pad, you'll be better able to visualize the skin line, right? Because a standout pad will give you that extra layer where you can actually see the most outer portion of the skin. Okay, so if you have like you guys have been doing probably lipomas, right? Mm-hmm. Everybody here seen a lipoma yet? Okay, and a lot of times, depending on how raised that skin is, they'll use an actual stand-on pad. Or if you have a bump or a nodule hanging outside of the skin, you know, above the skin itself, you use a stand-on pad or a glove filled with water so you can have that extra layer so you're actually able to see the entire skin line. All right? So the thickness of the skin should be 2 millimeters or less. If there happen to be changes, if there happen to be changes are thicker than that, they may indicate some kind of new growth, traumatic, post-irradiation, or inflammatory changes. Right? And that's the skin layer. The nipple, guys, it's a homogeneous texture with medium level echoes. The nipple areolar complex can cause acoustic shadowing. Sometimes you won't be able to visualize posterior to the nipple. Okay? Probe compression and the use of ample scanning gel will flatten the nipple and reduce trapped air pockets. Okay? Because, again, that's the reason why you can't see, because ultrasound can't travel through air, right? You have air pockets within the nipple itself, which is going to prevent visualization posterior to that. All right? Because what happens when ultrasound hits air? What happens to it?
It's go everywhere.
It scatters, right?
Yeah.
It scatters, right? The sound will scatter when it hits air. Okay? The sound will scatter when it hits air. So, the use of a lot of gel, heavy gel, will help kind of fill in some of those air pockets, and then you'll have visualization. Right? Remember, the nipple and the alveoli, the alveoli have those Montgomery glands. Those are those glands that secrete oil, but even those have like air pockets in them or hold them. So use a lot of gel to kind of fill in that space.
Montgomery.
And you'll be able to visualize a lot better. All right. Transducer angulation, spatial compound imaging. Spatial compound imaging is a special imaging technique. We'll talk about that in chapter 15, okay, in physics. Okay? It's a different way to acquire images in different planes, multiple planes. Okay? Utilization of two-handed peripheral scanning techniques, okay, are ways to help you visualize the nipple better. Angulation, not directly scanning on top of it, but angling into it will help you visualize it better. All right. So again, I highlighted everything in blue that's most important. That's not to say you don't have to know this other stuff too, right? Okay. Because even though I highlighted on the last test, some of you guys were still missing those questions. All right, so let's talk about the pre-memory layer, guys. That's the subcutaneous fat layer. That's the layer between the skin and the memory layer, but it doesn't extend beneath the nipple. Have you guys really noticed on our previous pictures, what extends to the nipple? The glandular layer, right? The ducts have to come to the nipple. So the subcutaneous layer, the pre-memory layer, will only be around the nipple. It won't extend all the way to the nipple. If we go back, I'm sorry to go back so far, guys. Apologies. But if we go back to our image, where is it at? Right here. You can see our subcutaneous layer doesn't come to the nipple itself. The nipple is surrounded with the glandular layer, the memory layer, the parenchymal layer. Okay? Sorry about that. Should have had that picture closer to it. All right. The echogenicity of fat will be a mid-level grade and easily compressed. Okay, it's fat, it has water, and it's going to be compressible. Also, you guys are probably used to seeing fat as being really echogenic, right? Fat is usually echogenic. When you think about fat, when you're doing an abdomen, it's more echogenic than anything else. Think about a fatty liver. Fatty liver meaning it's more echogenic than the kidney, correct? Okay, but in this case, the fat within the breast tissue is going to be a mid-level grade. All right. So you're also going to see in the pre-memory layer, you're going to see the Cooper's ligaments. Those are the thin hyperechoic, curvilinear structure or bands ascending toward the skin and encasing the fat lobules. Okay. You guys, whenever you guys do breast, you see the Cooper's ligaments very, very easily. Okay. You see them even better if you happen to visualize the breast in radial fashion. If you happen to visualize it radially. Okay. And let's talk about what radial scanning is compared to transverse scanning and sagittal scanning. Okay. And you're gonna have everybody's been in breast, so I'm sure you see them scan radially, correct? No?
We not.
Huh?
We don't have clinic at breast.
What you mean you don't have clinic at breast? You guys don't have breast here?
We're not the guy.
Not the
all of
guys.
them.
Just some people, right? It's only 8 rotations, so everybody won't have breasts.
Me and Sophie.
We're gonna get you in there. You have to get a comp before you graduate. So
Yeah.
you get in there.
Oh, before you graduate.
So you get in there. Okay? So guys, that's our pre-memory layer, our subcutaneous layer. Okay? Does it surround the nipple, yay or nay?
No.
Nay. Nay. Okay. So the memory layer, guys, that's where the glandular layer, the functional layer, where our TBLUs are. Okay. The parenchymal layer, that's going to be enclosed between reflective interfaces of anterior and posterior mammary fascia. Okay. It has the greatest variation in echo pattern because it depends on the distribution of the glandular structures, and the glandular structure also isoechoic to the fat. Okay. The fibrous area is going to be hyperechoic to the fat. Okay. That's in blue for a reason right there. Hyperechoic to the fat and the fatty tissues. Ducts are best imaged in radial scans and should measure 2 millimeters or less. Okay. So guys, I don't want you guys to think that when you see ducts that something is wrong with this person because they may be pregnant or they may just be lactating, you know. So if they measure 2 millimeters or less, that's normal. Okay. And you see them best in radial scans again because why? Our lobules, the lobules of the breast, they're and the ducts are located radially around the areola, or radially around the nipple, correct?
I'm sorry, I missed something. Did you say if they're lactating, it would be bigger than 2 millimeters?
No, even if they're
Oh,
yeah.
that's the max.
So the retromemory layer, guys, that's also another small fat layer right there. Contains small fat lobules and some suspensory ligaments, also known as what? Cooper's ligaments. Cooper's ligaments. Okay. And that layer is thinner than the subcutaneous layer. Like I said, the subcutaneous layer, the pre-memory layer, has the more fat than the retromemory layer. Just posterior to the retromemory layer, we have the chest wall, consisting of the striated pectoris muscles. Okay. And that's how you visualize muscles, because you'll actually see the striations within those muscles. Okay, these striations are going to be hypoechoic and hypoechoic linear structures or bands running parallel to the chest wall. Okay, those are what the muscles look like. And the ribs and intercostal muscles, bony ribs, of course, when you see the bony ribs, they're going to attenuate that sound. You're going to notice they're ribs because you won't be able to see the sound behind it. That feature. Okay. Alright, so here's our image right here, guys. There's our skin line, guys. You see our echogenic bands, one echogenic band, two echogenic bands with a medium gray in the middle of it.
Mm-hmm.
That's our skin line right there, guys. Okay, right posterior to that, we have our pre-memory zone and our subcutaneous fat layer. Okay, you see our Cooper's ligaments right there. You see those little striations, those line striations, attaching our glandular layer to the skin. Okay, those are the Cooper's ligaments. You're going to see them all through the pre-memory zone. All right. Then right posterior to that, remember I said this is fat, right? Remember I said how it looks on ultrasound. The pre-memory zone, you would think fat would be brighter than anything, but actually the glandular layer is going to be, the memory zone is actually brighter or more echogenic than the fat layer, the subcutaneous layer. Okay, so we have our skin, our pre-memory zone, subcutaneous fat, Cooper's ligaments, our memory zone right here. Right posterior to that, you see our thinner, much thinner retromemory zone and our retromemory fascia right there. I forgot, FGT, guys, that's fibroglandular tissue in the book, right? Look at that picture, guys, because that's what it says on it. Fibroglandular tissue. Y'all looking at this picture in the book? Y'all don't even have your book on. Okay. That FGT, that's fibroglandular tissue. Again, guys, if you're not reading this book, because I don't have every single thing on the slides, okay? I'm hitting the most important points, so you do have to read that book yourself, okay? Especially if you want to prove something to me that, that's not correct. So, right posterior to that, guy, the retromemory zone, you have, what's this right here? What's PM? Pectoralis major. Guys, you can see the echogenic and the hypoechoic and hypoechoic striations running parallel with that muscle right there. Okay? That's how you're going to know. Then right posterior to that, you're going to see our ribs. I'm not sure if that's a rib or not, but that's where you'll see the ribs in this space. So you want to see all these areas when you're visualizing these structures. Okay? So I love this picture right here, guys. I'm used to seeing it.
So this is transfer or no?
That is like a long image because of how the muscles are running.
Elongate.
All right. So here is I can see our ducts, the lady's ducts right there. See our hyperechoic glandular tissue right there. See how much hyperechoic it is in our fat layer. Hey, don't forget that. See our skin layer, hypoechoic. Well, you can't see the anterior skin line, right? Not that well, but you can see the posterior skin line and the medium gray.
Oh, this dermis?
Huh?
The skin layer?
Yeah.
Dermis or epidermis?
You can't see the epidermis because you're right on top of it. And that's why I say you may use a stand-out pad to be able to see right above that's right at the epidermis.
So 90 degrees.
You just need a little space because you're right on it. Ultrasound isn't catching it because it's right on top of it. It isn't catching that first layer. Okay? Then you have, what's this guys right here?
Measure.
It's not in the book, but if you see this echogenic area, what's right posterior to the glandular area? Retromemory.
Memory zone.
Retromemory. Guys, know your zones. Know your zones. Okay? And this would be another image of ducts right here. Look like, I don't know. They don't have a measurement right there, but I don't know if that's enlarged or not. But if you do see the ducts, measure them, and if they're 2 millimeters or less, they're fine. Okay? And here goes the nipple right here, guys. The nipple right here. All right? So, lymph nodes, just like on the last exam, guys, often visualized in the axilla. A lot of times you won't be able to see the Rotter nodes, or unless there's something wrong with them. Okay, A lot of times you won't be able to see them. So most of the lymph nodes are always going to be visualized in the axilla or the armpit. They're going to be less than 1 centimeter if they're intramammary, meaning they're in the glandular zone, the parenchymal zone. All right? They're going to be oval, right? Oval, well circumscribed, parallel to the skin, symmetric, hypoechoic outer cortex, like a kidney almost, right? Look like a kidney with the medulla and the sinus, right? Okay? And a hyperechoic fatty hilum. Again, they're gonna have that oblong appearance, like Hey Arnold's head. Long appearance, echogenic inside. Okay? Remember, if they're round, that means there's something wrong with them, right? Because they shouldn't look round. They should look like a football. All right? And the color Doppler, you will actually see a single feeding artery and vein at the hilum. I won't say you always will see the vein, but you should always get some blood flow whenever you put color on the lymph node in the actual hilum itself. All right? So think about the variations in normal patterns. Right there again, these are different zones. You got subcutaneous fat layer, our glandular layer right there, retromammary layer right there. Okay? Remember, the glandular layer is the most echogenic layer. Okay? That's where our functional units of the breast are. So, of course, the breast doesn't have the same appearance on every single person, right? That's why it's so difficult to image them at times. But the amounts of stromal and glandular tissue in the female breast depend on age, parity, menstruation, pregnancy, lactation, and or obesity. Okay? Remember we talked about that earlier. If you have more fat, it's going to change the appearance of the breast. All right? So, during puberty, of course, you have estrogen and progesterone, breast development, and duct growth and lobular development. Increased glandular tissue, isoechoic, mildly hyperechoic to the fat. I should have put that in blue. The glandular tissue is isoechoic, mildly hyperechoic to the fat. Okay. In the adult breast, they have the greatest range of appearances. Usually prepubertal ladies or females, their breast appearance is gonna be the same. Okay? But in the adult breast, they have the greatest range of appearances for many reasons, like we just stated. Okay? Young women that have never been pregnant, their breast is going to be densely glandular, but with age and pregnancies, fatty replacement begins. The older you get, the more fat is going to deposit into the breast. All right? Duct dilation may be marked during late pregnancy and lactation. See right here? Duct dilation. That definitely, I don't know. I don't have a calipers on that. That definitely looks more than 2 millimeters to me. Okay?
So the complete breast development after the first delivery.
I won't. No, you have breast development during puberty, but you have the breasts are more dense before a woman has kids. Okay, because she hasn't, the glandular function of the breast, the functional units of the breast have never been used, or she never needed them. Remember, because I said the ascenia, they're kind of involuted on each other. They only hypertrophy when they're actually lactating. Okay, so you've never had the ability or had the reason to lactate, meaning you've never been pregnant. Then